My name is Joanne Morris and I'm Consultant Clinical Scientist. So my specialty is Clinical Biochemistry. In Clinical Biochemistry, we diagnose and manage disease in patients by analysing body fluids. So we mostly look at the fluid part of blood, but we also look at urine and spinal fluid and sometimes even saliva. We test for numerous things. We look for proteins, enzymes, hormones, vitamins, and what we do is we look at the patterns of the test results to tell us why a patient is feeling unwell.
Yeah. So have we got quite a few new patients on there?
Yeah.
So I did an undergraduate degree at the University of Manchester, and the department that I worked in had strong research links with the local hospital, and I was very fortunate that I did a work placement with the hospital pathology department, and that's where my interest in medical biochemistry started.
You bring me the patient details. I'll have a look and see if have they got any previous.
I think we provide really vital information that help doctors make diagnosis of disease in patients. It's really important because that allows them to make sure that patients receive the correct treatment. We also do things like we do tests that help doctors decide if a patient is well enough to receive treatment and also if that treatment is effective. So, for example, patients who are undergoing chemotherapy. The laboratory can also provide results very quickly, and that allows doctors in critical situations where patients are acutely unwell to act quickly and save lives. Hello, my name is Joanne Morris. I'm calling from the pathology department at the Whittington Hospital. I have some critically abnormal results on a patient. We're very much a support and advisory service for medical professionals. So we will do things like we will look at patterns of results and we look for particular patterns that help with diagnosing a patient's illness. We also give advice on making sure that we get the correct sample in the laboratory, that it's taken into the right blood tube, that the patient is prepared appropriately. So, for example, for a lipid test, you may need to be fasted. If you want to look for a drug level, you need to make sure that the blood sample is taken at an appropriate time after that drug has been given to the patient. A very key part of our job is actually alerting doctors to critically abnormal results so that they can act in urgent situations. So one particular case that stuck in my mind is a number of years ago. I had a very high potassium result on a patient at about 7 o'clock on a Friday evening. It was a patient from a GP, and the GP surgery was closed. It took me about an hour of phoning round to find an on-call doctor that was able to take the result. So a high potassium will affect how your heart beats. It affects the electrical rhythms in your heart, and it can be extremely dangerous and life-threatening. So the doctor phoned for an ambulance for the patient, and as the patient was coming into A&E, they actually had a cardiac event in the ambulance. Had they not been in the ambulance, they wouldn't have survived. And I found out about this because the patient's daughter actually phoned the lab on the Monday morning to thank me because her father lived on his own and he wouldn't have survived. So I work in a blood sciences department, so that includes clinical biochemistry, haematology and blood transfusion. In biochemistry, there's myself and one other clinical scientist. We have 3 haematology doctors and about 26 biomedical scientist staff and about 30 medical laboratory assistants. So we're quite a large team.
Generally, we would be talking about patient samples, results that have come through that are abnormal.
I don't really have an average day. I think that's one of the things that I really love about the job. Every day is slightly different. The types of things that I do on a usual day would be we have a clinical authorisation rota where we look at patient results and we will add interpretive comments to those results. We will discuss them with doctors both in the hospital and with GPs. We will give advice on what we think those patterns of results mean as far as a diagnosis for a patient and make recommendations on other tests that might be useful. I go to lots of meetings, so I chair the Trust's Point of Care Committee. So point of care testing is testing that's actually done outside the laboratory setting by doctors and nurses at the patient's bedside. And what we do in the committee is we make sure that that is being done in the safest possible way. I'm part of the Patient Safety Committee for the Trust, and I also have a lot of involvement in audit. So with clinical audits, we look at what we're doing and whether our practice follows national guidelines, if we're doing things well, and how we can make improvements in our service. The favourite bit of my job, I've probably got two favourite bits of my job actually. So teaching, I love teaching. I find that really rewarding and really interesting, and you always learn something as you teach other people. And I also enjoy the clinical interaction, so talking to doctors, particularly when they've got a difficult patient that they've spent a lot of time trying to work out what's wrong with them. And they'll talk to you and suddenly you get that light bulb moment where you realise exactly what's wrong with that patient, and you can then suggest a test that will make a final diagnosis.
So this is a protein electrophoresis gel, and a serum sample has been applied to the gel, roughly here.
So I teach undergraduate medical students. I teach both postgraduate GPs and hospital doctors. I teach biomedical scientists and other clinical scientists, and I've also done some teaching on undergraduate science degrees. So that teaching has a few different formats. So sometimes it will be formal lectures as part of a university education programme. We often do case-based discussions in small groups where we will look at interesting patients and interesting sets of results as a teaching tool. And we do laboratory tours. So we will bring our new doctors and our nurses around the lab to show them what we do, and that helps them to understand how to best use our services. So I've done quite a lot of work on myeloma, and that was my research interest.
Yeah, that's your research thing.
Absolutely, yeah, there are lots of opportunities for research. So not always necessarily leading a research project yourself, although a lot of that does happen in laboratories, but also feeding into research projects that are going on right across the hospital. So yes, we do a lot of work to support research. So the most recent research that I've been involved in, I did a project looking at a marker for a blood cancer called myeloma. So there were two things that this marker could potentially do. One was to identify patients who had a precancerous condition to assess their risk of progressing to develop cancer. And the other was to look at patients who were diagnosed with myeloma to see how effective the treatment they were receiving was, and once they were in remission, to also detect relapse. So we collected 150 patients, and we looked at their results and we compared them to the markers that we currently use in the laboratory, and to determine whether that marker was going to give improved diagnosis and monitoring for the doctors treating those patients. And the study was very successful. So yeah, we had very positive results.
The might come round and do the something for me a minute.
So the job is very busy, it's quite demanding. There is some requirement for out-of-hours support for the laboratory, so occasionally I'll get calls on a Saturday afternoon where they've got a particularly difficult clinical question. The postgraduate qualifications for the fellowship exams for the Royal College of Pathologists are very difficult, but actually I find the study rewarding, and the achievement of passing the exams, and I think I do have a really good work-life balance. So I've got a young family and I've worked flexibly since my eldest child was born. I think the NHS is generally a family-friendly employer, and I've been very fortunate that I've had senior colleagues during my training who've been very supportive in allowing me to continue my career, and I get a good amount of time at home with my family and with my children. My children keep me very busy. But we enjoy travelling widely. I love to read, particularly fiction novels, to help turn off my brain. We do lots of cycling and hiking, and I love live music. So I applied to a national training scheme for clinical scientists, and I was based in South London for 4 years. I did placements in a number of hospitals, so some teaching hospitals and some district general hospitals, and also some specialist labs. So I went to a specialist endocrine lab, some toxicology, some neonatal screening for inherited disease. During this time I also completed a master's degree in clinical biochemistry. After 4 years I qualified as a clinical scientist and I registered with the Health and Care Professions Council. I then began studying for my Royal College of Pathologists Fellowship exams. So those exams constitute of written exams, practical oral exams, and then you have to do a piece of medical-based research. That usually takes about 7 years, but I had a number of periods of maternity leave, so it took me about 10 years to complete that. Contact your local laboratory, try and touch base with a real-life pathologist or clinical scientist, talk to them about what their job is and what it involves. Spend some time in the lab if they will allow you to, because that will give you a really good insight into what the job actually involves. So the Association for Clinical Biochemistry has a list of all clinical scientists that are registered with the Association for Clinical Biochemistry. So what they probably wouldn't give out details directly to a student, but they may be willing to contact somebody in a laboratory with that student's details and pass the information on so that they can come back to a student and talk to them. I think the medical schools also can be very good and proactive in actually arranging. So one of our consultant leads for training here has been doing some work with us recently where they bring the medical students in and we give them a laboratory tour and we give them a short presentation about some of the tests and what they mean, and they get the opportunity to actually come and talk to us. So I think more and more medical schools are starting to do that kind of work. So I'm a very passionate advocate of the NHS. I think the fact that this country has a healthcare system which is free at the point of access to everybody is a really important thing, and I think it's a real privilege to be able to do a job that helps people. I love the fact that I learn something new every day, and no 2 days are ever the same.